One doctor who's championed the call for the Charlotte Maxeke Johannesburg Academic Hospital to be reopened is Professor Dania Ballett, the head of Wits University's School of Clinical Medicine. She went as far as petitioning to have the facility operational once again, calling the situation nothing short of humanitarian disaster. Professor Ballett joins us now for her reaction to adjusted level 4 lockdown. Professor Ballett, thank you so much for joining us. First of all, your reaction to the reopening of Charlotte Maxeke Hospital. We just spoke to the CEO. They are taking in radiation oncology patients. Is this a relief to you? Good news?
It's wonderful news. We really welcome the reopening of the hospital and the fact that the Premier and even the President in his address last night supported the reopening of Charlotte. This is a national hospital. It serves a huge population. It has, I think you mentioned in your news report, almost 300 high care and ICU beds. It's got more than 1,000 hospital beds, and we really need that hospital at the best of times, never mind in a COVID pandemic, to be open. So it is very good news that the process has started.
The CEO of Charlotte Maxeke was saying that they're only accepting right now radiation oncology patients. So the beds that would be open to COVID patients not yet available. So it's a victory, but not as big a victory as we'd like to see.
Absolutely. I think one has to acknowledge that reopening the hospital, particularly after the fire, cannot just be an instantaneous thing. It will be a phased approach. But what we are hoping is that the parts of the hospital that were not structurally damaged in the fire, namely blocks 1, 2, and 5, will soon reopen as well. And that will go a long way to addressing the issue of ICU, theatres, and high care beds.
Let's go back to the president's announcement yesterday of adjusted level 4 lockdown. Do you think the restrictions that have been put in place are enough? Are they going to make a difference, or is it too little too late?
I'm not an expert in vaccinology or infectious diseases, but certainly the surge, we are in the surge already. And it probably would have been prudent to try and do these things a little earlier. And also, we would like to see the vaccine rollout to be accelerated to all people.
Each one of the doctors...
Because vaccination...
Sorry, please continue.
Sorry. I say vaccination is really the key to ending the pandemic.
Yeah, well, each one of the doctors and nurses that we've spoken to have raised concerns of hospital capacity. The president spoke yesterday about bringing more beds online. But is it a problem of a shortage of beds or manpower?
The problem is manpower. So whenever we speak about a hospital bed, obviously we have to have the equipment and the staff, the healthcare workers, to take care of the patients. And a particular cadre of healthcare workers that we lack sufficient numbers of are nurses. Unfortunately, we don't have enough nurses in the country, and that is a limiting factor for opening hospital beds.
Is it that we don't have enough nurses in the country, or are the nurses there, but there isn't enough of the finances to get them to work?
We have a shortage of nurses, apart from the finances. So we are in a resource-limited country. We don't have the budget that high-income countries do for our health services, but we also have a lack of nursing, of qualified nurses in the country.
Oh, Professor Ballett, thank you so much for taking the time to speak to us, and thank you for the work that you put in to try and get Charlotte Maxeke Hospital to reopen. Professor Dania Ballett, the head of Wits University's School of Clinical Medicine, thank you for your time.